this acronym is to help you remember the postoperative care of a patient with cleft lip repair. So a cleft lip is a congenital slit in the skin above the lip, and it's typically associated with a cleft palate. And the typical treatment is reconstructive surgery. So postoperative care is a lot of monitoring and education from the nurse. So cleft lip, CLEFT LIP. So C, choking. You're monitoring for choking. L, lie on back. You want the babies and the kids to lie on their back, because if they're lying on their stomach, they're going to mess up the sutures that are on their face. E, evaluate airway. Airway is essential in these patients. You have to make sure that you're not getting some post-operative edema, which could compromise your airway. So you're evaluating the airway. F, you want to feed them slowly. You don't want them aspirating. T, teaching, essential both preoperatively and postoperatively. Hopefully postoperatively you are really reinforcing the preoperative teaching, and postoperatively you're able to kind of demonstrate and answer very specific questions and whatnot. L, larger nipple opening. So if they're bottle fed, they're going to be using typically a nipple that has a larger opening, so it's easier to eat and they don't have to suck quite as hard. I, interestingly enough, increased incidence in males. So cleft lip has an increased incidence in male patients. And the last one is P, prevent crust formation and aspiration. So you want to make sure that they know and that you know that you have to clean the suture very frequently, because if this crust forms on the suture where the suture is, the incision, it impedes wound healing. So make sure that they are educated appropriately on proper wound care. So again, it is cleft lip. C, choking. L, lie on back. E, evaluate airway. F, feed slowly. T, teaching. L, larger nipple opening. I, increased incidence in males. And P, prevent crust formation.
This has been another episode of the Nursing Mnemonics podcast by NRSNG.com with your host, Katie Kleber, RN, CCRN. To grab all of our nursing cheat sheets, head over to NRSNG.com/freebies. That's NRSNG.com/freebies. Thank you so much for being here today. We love you guys. We thank you so much. We want to see you guys succeed. Listen, we're all in this together. Now go out and be your best self today. Happy nursing.